This conference will now be recorded.
In our last session, we were discussing about the Ahar Pajanam and something about the importance of Pajaka Pittam, Grahani, all these things. And as you may be knowing, the uh, mind is also very important in the functioning of this Pajaka Pittam, Grahani, all the activities related to the Ahara Pajanam. The status of mind is also very important, which we will be seeing in the chapter, in the text. So I'm not going to the details of that aspect. Chinda shoga bhaya krodha dukkha shayya prajagraihi annam na jidyadi, that we will see later. Then regarding the strength of the grahani, that is very crucial. That also we mentioned in our last session. It can be normal, what we call as the samyak sthiti of grahani or balavati grahani. So bhuktam amashaye ruddhva sa vipachya nayatyathaha balavati. Abala tu annam amameva vimunjati. Abala tu annam amameva vimunjati. So generally there is one more option. Sometimes it can be see some sort of a something shifting to the other end as well, like balavati normal, abala annam amameva vimunjati. Sometimes it can be holding the annam unnecessarily for longer time as well. That is also an option. That also can happen, and clinically we see such cases also. So that also should be taken into consideration, if even though it is not explained separately in this shloka. In this shloka means this bhuktam amashaye ruddhva sa vipachya nayatyathaha balavati abala tu annam amameva vimunjati. So that is the normal functioning and its distortion. Then this gives us an overall idea about what all things are happening. Then another important aspect which we have to discuss in this context is about Agni dushti, the possibility of Agni dushti. So while discussing the matra and everything related to the normal ahara pachanam, we should have a fairly good idea, not fairly good, an extremely good idea about the possibilities of Agni dushti and its consequences. So Charaka explains it very beautifully, isn't it? In the chapter of that Grahani, he explains it very beautifully. That 6 lines which we see in Grahani Chikalsitam. Abhojanad, ajirnadi bhojanad, vishamashanad, asatmya guru shita adiruksha sandushta bhojanad, virega vamana sneha vibramad. So that is something like iatrogenic causes. Virega vamana sneha vibramad. When you do certain treatments which can have direct influence on the status of Agni. We all know such aspects because we are all practitioners. So how important is the samsarjana kriya, the peyadikramam, yadha anuragnistranagomayadhi sandhukshyamano bhavati kramena tadha. That is the way in which the Samsarjana Kriya, the Payadi Kramam, is going to ignite the Kayagni properly back to the normal status. So here it is mentioned Virega Vamana Sneha Vibramad Vyadhi Karshanad. Any long-standing ailments, any ailment, long-standing ailment, disease, Vyadhi will cause Karshanam. Vyadhi Karshanam. We have seen in one of our previous lessons, previous sessions earlier that Bheshaja Kshapitaha. That is also a possibility. Here it is Vyadhi Kshapitaha. The Vyadhi can cause Kshapanam, Dhadu Kshapanam, Deha Kshapanam, Bala Kshapanam. Vyadhi as well as Chikilsa, both can be challenging to the Shariram and Manas as a whole, and also to the Agni in particular. So Vyadhi Karshana. Then Deshakalartu Vaishamyad. Deshakalartu Vaishamyad. That is the influence of the Desham and Kalam. Desham and Kalam, many times you will find them explained together. Even in a situation where it is not explained together, maybe only one is mentioned, the other one also should be understood, because generally they go together. So Desha Kala Ritu Vaishamyad. Kala Vaishamyam, Ritu Vaishamyam, they are not different. Desha Kala Ritu Vaishamyad. Kalam has got another meaning also. We all know that Kshanadir Vyadhyavastha cha Kalo Bheshaja Yoga Krit. So here the Vyadhi Avastha Nirnita Kalam, that also can go wrong, and it can cause Agni dushti. So we all know that Kalascha Bheshajasya Yogyadam Adadhadi. So that aspect is also included when we see the Kalam and Rudu explained in two separate words. So Deshakalartu Vaishamya Veganam cha Vidharanad. Vegodirana Dharanad. We have seen that any disease can occur. It doesn't mean that all diseases occur just because of Vegodirana Dharana, but it warns that any disease can occur due to Vegodirana Dharana. So here also Agni Dushti can be a result of Vega Dharana. Dushyati Agnihi. So Abhojanad, Ajirnadi Bhojanad, Vishamashanad, Asatya Guru Sita Adiruksha Sandushta Bhojanad, Virega Vamanasneha Vibramad, Vyadhikarshanad, Deshakalartu Vaishamyad, Veganamja Vidharanad, Dushyati. So here we will find, if we look at the details, the fine details, we will find that here what they have tried to include is this kalartha karmanam yogo hina mithyadi matragaha. Or in other words, it is prajnaparadham. Prajnaparadham is a very resonating word. So we should have a deeper understanding in many planes of application about what this prajnaparadham is. Many things are not explained. Here, see nidra, a problems with the see asatmya nidra, adinidra, anidra. All these things also can cause agni dushti. So that is not, even though that is not listed here, that should be understood, because basically this is all about prajnaparadha. So from what whatever is explained, all others which are not explained should be understood. Then dushyati agnihi, agnihi dushyati. Then what happens? Sa dushtonnam na tat pajadi leghu api. Saha dushtaha annam na pachadi laghu api. Dushtaha saha agnihi laghu api annam na pachadi. So what to say about the Guru Bhojanam? Even the Laghu Bhojanam is not getting processed properly. Then what happens to that annam? That is the way in which, or that is the twist in the story, entire story. Apachyamanam Shuktatvam Yadi Annam Visharupatam. Apachyamanam Shuktatvam Yadi Annam Visharupatam. Apachyamanam Annam Shuktatvam Visharupatam cha Yadi. Shuktatvam is a state of Amli Bhava, and that is a result of unnecessary and sort of a uncontrolled vidaha, this Shuktatvam. And it turns to a form of Visham. Shuktatvam Visharupadam cha Yadi. So our intention was to make the Annam, Sharira Dhadu, Balam, Ojas, all these things. But here, unfortunately, it is becoming Visharupadam. Then Charaka is very eloquent about the consequences of this Agni Dushti and this Visharupa, Shuktarupa, Ahara. So he is continuing. Tasya lingam ajirnasya vishtambhaha sadanam tadha shirasorukcha murcha cha bhramaha prishthakadigraha jrumbha angamardaha trishna cha jwaraha chardhi pravahanam arojakaha avipakaha cha. So once this Visharupa, Shuktarupa distortion of the Ahara happening in the Koshtam, the Amashayam, and it continues to persist, slowly the body starts showing certain features which will not be, or which need not be, connected to the status of the Agni in the conventional compartmentalized specialty medical practice. That is a problem. That is a problem. So here we find Vishtambha, Sadanam. There may be many cases coming to you complaining of severe Sadanam, tiredness, severe tiredness, lack of enthusiasm. And sometimes they may complain it very specifically. If I take my regular meal, then this becomes more pronounced, Sadanam. Then recurrent episodes of Shirasoruk, Murcha, episodes of some sort of a disconnectedness, Brahmaha, that giddiness, Prishthakadigraha, Prishtha See here, Prishthagraham, Kadigraham. Actually, this need not be limited to Prishthagraham and Kadigraham. It can be Graham of any Sandhi, wherever this Vayu and Kledagakabha are, sorry, not Kledagakabha, Shleshagakabha are operating. So it need not be limited to Prishtha and Kadi. Prishtha and Kadi Graha are the primary targets because of their immediate vicinity to the focus or epicenter of the events. Jrumbha, which is very common. These things are presented very often. Angamardaha, Angamarda, again, very frequently presented. Trishna, Trishna is not thirst, but a status where the thirst is not subsiding even after consuming plenty of water or fluid. Jwaraha. So jwaram, ajirna jwaram, ajirna janya jwaram. Again, this need not be understood as connected to the status of the Agni. Chardi, pravahanam. So urdhva adhaha cha. Arochakaha, arochakaha. The ruji aspect is lost, but still he or she may continue to eat, because eating is basically an exercise which is done on a time-based manner. And avipakaha, arochakaha, avipakaha, avipakam, it is not getting processed in the basic level and also in the subsequent levels. So practically what has happened is, this annam is now some sort of a, cannot process it. It cannot process it. So it has become a liability. So there will be every attempt to come out of this liability, to get rid of this burden. And when it fails further, slowly the involvement of doshas will become stronger. So up to that, it is something like an agandu issue, because annam is basically a foreign body, and it is becoming the part of the system only when it is properly processed. Otherwise, it is a shalyam, like as we call the garbha shalyam. Anna shalyam is also there. This is an anna shalyam, and as it continues to get retained in the system, slowly it will invite nija vikaras. That is the problem, and that is not the problem. It's the beginning of a series of problems. So Charaka explains, ghoram annavisham cha tad ghoram annavisham. The word used is annavisham. See how to see contradictorily positioned substances clubbed together to form a vicious circle, a negative loop which is going to threaten the existence of the system. Ghoram annavisham cha tad samsrujyamanam pittena samsrujyamanam, when it is getting attached to the pitta dosha dushti, then daham trishnam mukhamayan janayadi amla pittam cha pittajams cha aparan gadan. Actually, whatever is explained, they can be considered as the earliest and maybe the simplest manifestations of the issue. Something like an uttanavastha. This Uttana Avastha will slowly will become Gambhiram. And that Gambhira Avastha, that means deeper penetration into the system and the clinical manifestations of the corresponding types. That is Pittajamscha Aparan Gadan. Aparan Pittajan Gadan. Infinite. So otherwise, in the initial stage, we find Daham, Trishnam, Mukhamayan. So in many cases of this Mukhamayam, maybe something like Mukhavranam, it need not respond effectively and sustainably to local therapies, local management programs like Gandusham, Kabalam, or Sampradisarana. It may require deeper interventions. And recurrent Mukhamayam need not be Mukhapagam or Mukhavranam alone, but any sort should be considered as a faulty mechanism regarding the functioning of Agni is slowly getting set in the system. So it can be considered as a warning as well. Then Yakshma Veenasamehadin Kabhajan Kabhasangadam. Yakshma. Yakshma means Raja Yakshma. So as far as the involvement of Kabha with this Annavisham is concerned, the easiest option could be to get involved in the Samprapti of Yakshma. Of course, its extended versions or the lighter versions are seen in Penasam. Penasam is slowly is a Samprapti which has got the potential to slowly evolve into Rajakshma. Then Mehadin, Meham. Meham here means Prameham. So a Santarpana Uttavigara. Kabhajan, Kabhasangadam. Mehadin, Kabhajan, Aparan, Gadan. So many other Kabhaja diseases can happen because of the involvement of Kapha with this Annavisham. Karodi Vada Samsrishtam Vadajamscha Gadan Bahun. Karodi Vada Samsrishtam Bahun Vadajan Gadan. Then Mutrarogamscha Mutrastham. Again, it is the basic principle in Ayurvedic management that any presentation may be connected to the Srotas X or Srotas Y should be seen as an outgrowth from the core. That means from the seat of Agni. And any disease should be looked for its connection with the Udaram. That is why we have got a phrase called Udaram Vyadhi Mandiram. Udaram is considered as Vyadhi Mandiram. Then Kukshirogan Sagridgadam. When this Annavisham is getting attached to the Sagrit, it can create various disorders connected with the Kutshi. Kutshi is a non-specific word here because the presentation can be non-specific and diffusely spread. Then Rasadibhischa Samsrishtam Kuryad Rogan Rasadijan. Rasadibhischa Samsrishtam Kuryad Rogan Rasadijan. When we read out these portions from the Charaka Samhita, we should get at least we should recollect certain portions which we learn in the context of Visham directly. This is Annavisham. That means Annam became of the nature of Visham. Directly in the context of Visham, we find these sort of explanations. For example, in the case of dushi visham, we will find similar explanations, isn't it? Tenardido bhinnapurisha varnaha dushtasrarogi tridarojagartaha murchan vaman gadgadavag vimuhyan bhavecha dushyodara linga jushtaha. This dushyodara linga jushtatvam is possible in the case of Annavisham as well. As we see in the case of dushi visham, that dushyodara linga jushtada is possible in the case of Annavisham as well. Then in dushi visham we find आमाशयस्थे कभवादरोगी पक्वाशयस्थे अनिलपित्तरोगी पक्वाशयस्थे अनिलपित्तरोगी भवेन्नरो ध्वस्तशिरोरुहाङ्गः विलूनपक्ष्मः विलूनपक्षः pakshmah is a different thing. Pakshma means our something related with the netravayava. Here it is vilunapakshah, that means the wings. Yatha vihangaha Sthidam rasadishvadhava vichitran karodi dhadu prabhavan vikaran. That is to be noted. In the case of dushi visham, we find sthidam rasadishu adhava vichitran dhadu prabhavan vikaran karodi. Here in the case of annavisham, we find rasadibhischa samsrishtam kuryad rogan rasadijan. So they are almost similar. The explanation is similar, presentation will be similar, and in the management also we will have to consider the involvement or the presence of a sort of visham. That is why it is called as Annavisham. So this is very, very important. Then when that sort of a Annavisham as a result of Agni dushti manifests, what all things will be seen clinically? The patient may be presenting with the various types of complaints like no appetite. I have no appetite sometimes. Sometimes I have a Vishamagnita. Sometimes it is good, sometimes it is bad. Sometimes I feel that all the food is digested. Sometimes it is very burpy, gassy, distended, bloated. They will use n number of words to explain their struggle. Then sometimes it may be sour reflexes, and when these sort of issues are manifested with children, that is also very common these days, because we push them to eat extra unnecessary stuffs. We feed the children not to address their hunger, but to make sure that they never become hungry. So aharam is no more a tool to satisfy the hunger, but it is something, a luxury, which will make sure that the individual is never becoming hungry. So hunger is becoming very, very rare and very precious stuff these days. Then sometimes it can be adobam. Some noises are coming from that abdomen. Then vishtambham, bloated, gassy. Then many symptoms of the purva rupa of gulma, udgara bahulya, purisha bandha, triptya kshamatva, andhra vigujanani. These things can also happen as part of faulty Agni. Then there can be different tastes in the mouth. Tiktasyata, lavanasyata, like that. Virasasyata. Then the various types of shulam. In children, this is very important. When there is Agni dushti, children will start complaining of non-specific, severe, recurrent pain abdomen, which need not respond to the conventional line of management. If they go for some allopathic treatment routinely, they will go for some basic investigations, see the blood picture, And generally they start with some sort of a medicine for this gas trouble, and they may look like working in the early days, but it need not. Then antibiotic treatment will be routine. In Ayurveda, we also will be, especially when they come after allopathy consultation, we will see what can be done from Ayurveda as a replacement for this antacids. Then we will treat with that sort of medicines. Shangavasmam, blah, 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 all these things will be tried. Then sometimes what we will think what could be an Ayurvedic antibiotic. Then you may have your own antibiotic from the Ayurvedic side and you will treat it with that. Ultimately, the child will be in trouble. Nothing is going to happen. And interestingly, when you go for an ultrasound scan, you will find non-specific mesenteric lymphadenitis. Generally, this non-specific mesenteric lymphadenitis will not be taken as a matter of concern or something significant by the conventional Western medical practitioners. But that is a very valid observation. That's a very valid observation because it can be an indication of this Annavisham. It can be. Of course, to diagnose Annavisham, you need not go for a routine ultrasound. But when in such cases where many other things have already tried and not working, the child is still suffering with recurrent episodes of severe pain abdomen, a sort of conclusive assessment can be drawn if you go for an ultrasound scan and find that the child is having this sort of mesenteric lymphadenitis, and it will work, it will respond to a proper chikitsa for this Annavisham and Agni dushti I should say, than Annavisham. Then hrillasam, chardi, they will be very common. Hrillasam, sometimes that feeling that I may vomit at any time, sometimes that may continue and subside, but sometimes it may end up in chardi. Then sometimes the bowel patterns should be altered, sometimes it may be loose stools, Agni dushti, indicative Agni dushti. Sometimes it is very difficult to pass, sometimes soft stool but incomplete evacuation, like that. And there can be changes in the body weight as well. The fellow is eating very well, but the weight gain is very, very poor. Sometimes the person may not be eating much, but he is putting on weight like anything. Then there can be some mental features as well, like lack of enthusiasm, tiredness, then anger, irritability, poor attention span, then complaining of memory issues, then nidralutvam, sleepiness. So many such features and recurrent episodes of shobham in various parts of the body, shobham of atypical nature. Then tendency, especially in children, tendency for recurrent infections. In all these cases, we should focus on the status of Agni. Agni dushti should be addressed and corrected. Then most of these issues will subside without any specific focus on such individual complaints. So clinical presentation is so wide or broad that they should be understood properly. Then we have another important concern before coming to Matrashiti. That is about the important idea called amam. Amam. I will just brush up what we have learned earlier regarding amam. Okay, how is it explained in the basic level? We all know it is that ushmano alpabalattvena. That is why it is matter of interest for us. Ushmanaha alpabalattvena. Ushmanaha alpabalattvena. So there is alpabalatvam. Alpabalatvam of what? of Agni Ushma. Ushmano alpabalattvena धादुमाद्यम अपाचितं दुष्टमामाशयगदं रसं आमं प्रचक्षते. ऊष्मणोऽल्पबलत्वेन धादुमाद्यम अपाचितं दुष्टम आमाशयगदं रसं आमं प्रचक्षते. So I'll split the sloka. It is very interesting and very important. Ushmanaha alpabalattvena dhadum adyam apachitam dushtam amashayagadam rasam amam prachakshate. So rasam amam prachakshate. We call rasa amam. So amam is the name of rasam, but not the normal rasam. Rasam has got very specific characteristics to make it eligible to be known by the name of Amam. What are they? Number one, apajitam. Apajitam, it is either not pajitam or alpapajitam. Then second, dushtam. It is dushtam. It is not properly formed and it is afflicted by doshas. So that is why it is dushtam. Then amashaya gadam. It is amashaya gadam. Amashaya gadam means it is taken to the amashayam. That is one meaning. It is second meaning is sthidam. Amashaya sthidam, which is practically held back in the amashayam. So some way it is stagnated in the amashayam. Stagnated in the amashayam. The word amam itself indicates that there is a stagnation. The word itself is meaning that there is a stagnation. Then, so it is adyam dhadu, it is adya dhadu, then it is apajitam, it is dushtam, it is amasyagadam. And such a rasam is called by the name amam. And what is the reason? Ushmanaha alpabalattvena. Everything starts from that point. Ushmanaha alpabalattvena apajitam dushtam amashayagadam adyam dhadum rasam amam prajakshate. That is the full sentence. Ushmanaha alpabalattvena apajidam adyam dhadum dushtam amashayagadam, or dushtam amashayagadam adyam dhadum rasam prajakshate. This is very, very important understanding, because this amam evolves to amayam. Amayam is vyadhi. So amam is becoming some sort of a pluripotent seed. A pluripotent seed from which, you know, this pluripotent is a very common word. No, today itself I explained it to somebody else. Pluripotent means from the single position, many things having the potency to develop into many forms. Stem cells are examples. Stem cells are pluripotent. They can develop into any other type of cell, any other type of organ. Here, amam is a pluripotent seed from which any amayam can develop. That is an interesting fact. That is why it is so important. Amayam and amam. So that amam is the result or the outcome of Agni Dushti. Basically, of course, we all know that there are differences in the concept of understanding amam, which we are not going to highlight at this point of time, because our area of interest is Agni Dushti. Fine. Then, yeah, at least with this basic details, we will move on to the next area. The other explanation I'm not going to read out. Everybody knows it, isn't it? That Anye doshebhya eva adidushtebhya anyonyamurchanad kodrevebhyo vishasya eva vadandyamasya sambhavah. All these things are known to everyone, and it is not of any interest in our context. That is why I'm not going to explain it. Okay, then what else should be seen in the as some sort of a preliminary part in explaining Matrashiti? We all should know the presentation of Amam, especially Sama dosha. That is also very important. Amena tena sampruktaha doshaha dushyasya dushidaha sama ityuvadishyante ejarogas tadutbhava. And then srodorodha balabhramsha gaurava anila mudhada alasya bhakti nishtiva malasangaruji klamaha. So all these things we have seen. What is the nature of this amam, samanya lakshanam, and all these things. Then regarding the other aspects, we will come to it in the text regarding this management of amam. All these things are the basic things which we will be seeing in Matrashiti. Yeah, I think with this sort of basic understanding, we will switch over to our chapter Matrashiti. Okay, fine. At least we will start it today. Athado Matrashiti Adhyayam Vyakhyasyaamaha, or Matrashitiyam Nama Adhyay, the chapter which is well known as Matrashitiyam, the chapter which is well known, famous, that is Nama Adhyayam Vyakhyasyaamaha Idi Hasmahu Ratreyadayo Maharshayaha. So I'm going to explain this chapter which is well known as Matrashitiyam exactly as explained by the acharyas like this Atreya. Then Matraya Ashitam, Matrashitam, Matraya Ashitam, Matrashitam. Tasmai Hidaha Matrashitiyaha. So that is how the word comes, the name of the chapter comes. Matrashitiyam Adhyayam Vyakhyasyaamaha. This is a pradigna. This opening statement is actually a pradigna. That means this is the point. This is what I am going to explain or narrate in the coming areas of the chapter. And there is a one more categorical statement we find in Ashtanga Hridaya. Matrashi sarvakalam syad. Matra hi agnehe pravartika. Matra dravyanyapekshande gurunyapi laghunyapi. That is the first sloka, what we find. Matrashi sarvakalam syad. Sarvakalam matrashi syad. Sarvakalam, always. Sarvakalam. Sarvakalam matrashi syad. What is the sarvakalam? Sarvakalam means sagaleshu ahara kaleshu. It is not about every day, but within a day, every annakalam. Sarveshu ahara kaleshu matrashi syad. Matrashi matraya asidum sheelam asya idi matrashi. Matraya asidum sheelam asya idi matrashi. So matrashi syad. Whether you are a swastha or an adura, it doesn't matter. Both swastha and adura should have a proper understanding about the matra. If you are a vyadhita, rogi, how much I can take? If you are a swastha, how much I can take? In the morning, how much I can take. In the night, how much I can take. In the monsoon, how much I can take. In the summer, how much I can take. So it is a very interesting point. The concept of eating is here at this point is not simply limited to the stuff you eat. It is not limited to the stuff you eat, but it gives a sense that matrashi, it is something about the matra of the asanam. So how can you say that it is not limited to the stuff? Yes, it is not limited to the stuff. We are sticking on to the stuff because reason is matrahi agnehe pravartika. So our interest is actually agnehe pravartika, which all matra or which matra will make the Agni proper, stable, sustainable, healthy, strong. That is our interest. So the entire picture or the story is spinning around Agni. In Sangraham, we will find it in a different way, which we will come to, which will bring to our discussion later. Now we will focus on to the Hridayamelo. So matrashi sarvakalam syad because matrahi agnehe pravartika. Yataha matra agnehe pravartika. Jadharagnehe pajanarupa pravrittehe yadhavad utpadika. That is why we insist on it. Agnehe pravartika. And so matra is important because it is the Pajana Shakti Karini. Matra is the Pajana Shakti Karini. That is why we have a chapter called Matrashi. Sorry, Matrashitiyam. Then how to know about the matra? That is why how we come to the food stuff. Matra dravyani apekshante. Dravyani. Matra dravyani apekshante. At this point, there can be a question. Why Agni is so important? Why should we focus on the Agni? See, that question is relevant because our concept of eating has switched over to this much calorie a day, and out of that XYZ calories, this much should come from carbohydrate, this much should from fat, and this much should from protein, like that. We are more and more inclined towards some sort of a nutritionism. So the food has become immaterial, irrelevant. Food is replaced by nutritionism. So that is why this question is important. Which question? Why Agni is important? Our understanding about all these stuff is some sort of a host-centered. What is the host response? What is the individual's body response? In that question, the answer we get is Agni Moolam Balam Pumsam Balamulam Hi Jeevitam. Balam is the cause of existence, and that Balam is dependent upon Agni. That is why we repeatedly talk about Agni. Agni Moolam Balam Pumsam Balamulam Hi Jeevitam. That is why we ask the question about what will happen to the Agni if I eat this stuff at this time in this quantity. So, and this matra dravyani apekshante. This matra depends on the dravya. Guruni laghuni api. Guruni laghuni api dravyani apekshante. How much is the matra? That depends upon the guru laghutva of the dravya which you are going to consume. So here the concern is whether it is guru or laghu. It is not about whether it is carbohydrate, protein or fat. Whether it is guru or laghu is our concern. That is very important. So sloka I will read once again. Matrashi sarvakalam syad matrahi agne pravartika matra dravyanyapekshante gurunyapi laghunyapi. So I think we have something to discuss. Obviously there will be. So I'm stopping the text part here with this first sloka. We just entered into Matrashiti. After the last session, personally I got a few enquiries apart from the questions what we had in the chat box. And one most frequently asked the question was, how can we explain that this anna pajanam adau shadrasamapyannam madhuribhudamire. So that question was very frequently asked. More than one person asked that how this is, especially that idea which I was trying to communicate the other day. That means first there is madhura, then amlam, then there is the agni karmam, then rasam, then it further moves to the pakvashayam, some element of bhajana continues, then the rasa will be taken back to the amashayam. So that was the conflict, whether it can happen that the an adna rasam will be taken back to the amashayam or not. So I thought, okay, I will be explaining it today in our session only. So I think if I am permitted to share my screen, I will just try to explain this with the help of a slide. Dr. Neelesh, can you allow me to share a slide?
So you are now the presenter.
Okay, okay. Yes. You can see a slide now. Is my slide visible?
Yes, sir.
Yes, sir.
Hello, can I be heard?
Sir, you are heard. Your
Yes,
slide is
sir.
also visible.
Okay, my slide is also visible. Fine, thank you. So here, see, just 1 minute. Okay, see annam. Here we have got this annam, and it is, let it be in the mouth. Then pranavayu takes it to the amashayam. Then in the amashayam, it is the kledaka kapha. Even before that, there will be inputs of sneha from the, maybe in the mukha itself. There will be, and the anubanam type of things also will be contributing. Then it reaches the amashayam, where we have got kledaka kapha. We have got ranjaka pittam as well. Ranjaka pittam is also amashayasthita. Then here it is kapha predominant. Here it is kapha predominant. Madhuram. Then from this is the sequence which is happening. Kabha to a Kabha Pitta, Pitta, Pitta Vada, Vada. So from here it moves to the Pachyamanashayam. Here it is Amashayam. So here it is Grahani, and here the predominant player is Pajakapittam and supported by Samanavayu. And in the Grahani, this is the Pachyamanashayam, the Pajanam happens, and while go through the function of Pajakapittam and Samanavayu, we will find Pajatyannam Vibhajade Sarakittau Prathak. So that Sarakitta Vibhajanam happens at this point, but not complete. In the Samanavayu also we will find that Pajatyannam Vibhajade Sarakittau. And Annam Grahadi Pajati Vivechayadi Munjadi. So that Vivechanam, so these, they work together in tandem, and the rest of the things after this stage will be pushed to the Vada predominant Pakvashayam. So here it need not be complete. That is what I wanted to say in detail. So here the Vibhajanam is done. Once that Vibhajanam is done, Amashaya, the rasam will be kept here in the Amashayam, and the rest of the things will be pushed to the Pakvashayam. But in the Pakvashayam also, in this Pittavada to Vada stage also, some more, because here also there is influence of Pajaka Pittam and Samana Vayu in this transitional phase, in this Pittavada stage. So it will not be complete in at this point of Grahani. It will continue till it is becoming, reaching here. So the basic collection of Rasadadu will be done in the Grahani, sorry, in the Amashaya. So here it is from the Pachyamanashayam, it will be taken to the Amashayam. One mechanism. It is just a change in place in the same cabin. But here it is another area, Pakwas, it is Pakwasaya. Here, what I presume is two possibilities. One, Rasa will be, whatever is separated at that level will be taken back to the Amashayam. Certain share can be shifted to the Yagrit Pliha, Koshtangas, or Raktashaya, which is also considered as a Ranjaka Vittasthana. So we have got Ranjaka Vittam in Amashayam as well as in Yagrit Pliha. So this is a complex stage. That means this extraction almost initiates and get completed in the Pachyamanashayam, from which the rasa will be shifted to the Amashayam. You just remember about the definition of Amam, Dushtam Amashaya Gadam, Amashaya Sthidam, it is stagnated. So that means the formation or whatever it is to be happened, it should be happened here itself. But the rest of the things, whatever is left behind, that will be separated in its journey through the Pachyamanashayam to the Pakvashayam, where this Pitta Vada and Vada stages are complete. And then whatever is extracted has got two possibilities. It may be taken back to the Amashayam, and another thing is a share may be going to the Yagriha, which will work together, the sthanas of the Ranjaka Pitta. That means the Amashayam and the Yagriha will be working together in a later stage. So this is what I wanted to explain in the last session. Which are these srodhases which takes this annam ahara rasam from the grahani to the amashayam, and which is taking the pakvashayam to the amashayam, or from the pakvashayam to the yagrut pliha, is not explained as such. I do agree, but without such a mechanism, it cannot come into functional level. That is why I propose it. And these things are clinically important as well, especially when we are treating diseases of various types, which we will be seeing in the further explanation of Matrashitiyam as well, like the Vilambika or many other diseases, which we will explain. So I just put it in a single slide, something like a planned operating from the input to the end product or something like that, to give you a visual effect. That's all. I do not know how far I succeeded in communicating this idea. Of course, there are no conclusive points in it, but my request is to work on it further. And I'm strongly convinced about the possibilities of these two mechanisms operating, or even three. Okay, so that's all. With that, I'm stopping the share screen. Okay. Yes. Now, if we have some questions today, we will see. Or if you require more clarification about what I explained, that also can be discussed.
Yes, sure, sir. If there are any questions, you can just drop it in the chat box.
Sir, am I audible, sir?
Yes, yes, you are audible.
Sir, so from Pachamanashaya, why it need to go back to Amashaya, sir?
Because you see, as per the explanations which are given already, and to avoid the possibility of conflicting ideas coming together, I think we actually Pachimanashayam and Amashayam are not well separated. They are just some sort of a different regions within the same territory. They are not separated as such. But that separation is important because see, the if you go through the idea of srotas, we will find that the reservoir srotas, they start from that Amashaya, because the Vyana Vayu is doing that function, isn't it? Vyanena rasadhadurhi vikshebojita karmana yugapat sarvato ajasram. So it is taken from that area only, from the Amashaya only.
Yes.
So it should be, actually they are not different. That is what I'm saying. We won't find any reference like Pachimanashayam. It should be considered as Amashaya only. But
True.
for the sake of explaining the function of Grahani and the seat of Pachakapitta, we consider it as two separate areas. So there is no issue. That is why I told that need not be considered as separate. It is just a two different areas in the same territory. So most of the rasa is held in that area only, from which the reservoir srotas is moving, and Vyana takes it to the Hridaya, one share, but certain share will be left over. That will be again taken in the Pakvashaya, or in the transitional phase of the movement to the Pakvashaya, and that will be taken to the maybe to the Yagrut Priha, and also bringing back to the Amashaya. So that is an idea, that's all. This is very
Yes.
important in the understanding of Jwara. Apart from the explanation what we find in the Rasavah Srodo Dushti, or in the manifestation of Hridroga, in the manifestation of Jwara, especially in Vishamajwara Samprapti, everywhere this idea from where the Rasavah Srotas starts and from which area the Rasavah Srotas spreads, And also in the explanation and understanding of conditions like Amavadam, Urustambham, everywhere, this idea which I'm trying to convey is becoming clinically important.
Sir, even though the Amashaya is only one, for our understanding, we are making it as Amashaya and Pachamanashaya. When we say the Rasavaha Srotomula is from Amashaya, why can't we consider the part of Pachamanashaya as an Rasavaha Srotomula, and why it should be considered as Amashaya, the upper part, where we Urdhva Amashaya as a Rasavaha Srotomula, sir?
No, again, I'm repeating the same thing. That means there is no that entity explained as such as Pachimanashaya. It is just like a explanation for the sake of explanation of Pachana. In the Amashaya itself, there are two territories. So by identity, if you send a letter, the address will be Amashaya only. Got my point?
Yeah,
So there is no difference when we say that the Rasavaha Srotas starts from the Amashaya. There is no question whether it is from the Urdhva Amashaya, whether there is no Rasavaha Srotas from the Adha Amashaya at all, like that. There can be, because it is a continuous process which is going on. So there can be many things which may be starting from the Urdhva Amashaya or Purva Amashaya, and many things may be there from the Uttara Amashaya or Adhara Amashaya as well. My point was more specifically whether it is to be started from the Pakwa. Why there is no Rasavaha Srotas from the Pakvashaya? That was more important for me, because it is out of the territory of this Rasavyapanam. It is under the control of a different character. And if at all some rasa is formed, that should be given back to the territory which really owns that rasadhatu. So it is to be given back to either back to the Amashayam, or it will be sent for further processing by Ranjaka Pitta to the Yagrut Pliha. It need not be very anatomically correct. But definitely our shariram demands us to think into the finer aspects of these processes. That is why I am suggesting, it is not a conclusive statement. You all can think further about it. This is a suggestion. It is something like exploring one step down to what is explained in the textbooks.
Yes, sir. Now it is little more clearer than the first session, and definitely we need to think little more to get the ideas. Yes.
In the understanding of diseases like our in Shalakya itself, that means the vyapti of the dushta rasa to the netra or the jatru urdhva is through the rasa srotas only, and it should happen from this particular area. Then in diseases like our amla pittam becoming shida pittam, we are manipulating it at the level of amashaya only, not at the level of pakvashaya. That is the interesting part of it.
Yes, sir.
So all these things are suggesting that the rasa vyapanam is from the amashaya only, not from the pakvashaya. So within the amashaya, how far you can separate precisely the Amashaya proper and the Pachyamanashaya is another question. Actually, that is again, we have to go one step deep and find more precise answers, which is not impossible, which may be difficult, but which is not impossible, because when you are dealing with clinical situations, see whether there is a connection, like the vyapti of the dushtarasa into the urdhva kaya, maybe from the urdhva part, the upper part of the amashya, whereas the vyapti of the rasadhadu to the adhak kaya may be more from the lower part of the amashaya. And accordingly, if you select certain drugs, those working on the upper part of the amashaya may be working better with the jatru urdhagada rasadushti, and those medicines which can work on the lower part of the amashaya may be better in the diseases of rasadushti of the adhakaya. If such a proposal is possible and clinically evident, I think these explanations what I was giving will be really a new idea into the entire clinical practice. I'm not sure whether I'm clear or not, or I'm unnecessarily complicating the stuff.
No, sir. It's much clearer. It is getting much clearer now.
So we can work on it further. We can work on it further. Okay. Say to
Yes,
come
sir.
to a point.
Clinically, it is we can come.
Yes, please go ahead. Dr. Vijay Lakshmi, please go ahead.
Clinic when we compare it clinically, this explanation holds good. But what is the anatomical comparison? Like they say there is a pyloric sphincter will close and all those things. No, so how to analyze that in that view, that point of view? I wanted to ask that, sir.
Forget about it, Dr. Vijay Lakshmi, please. Because see, if we try to explain it in terms of the activities of the pyloric sphincter and the first part of the duodenum, etc., etc., all of a sudden they may change the entire story tomorrow. They may say that, okay, the pyloric sphincter is not at all involved in any of the activities of the digestion. Then we will have to rewrite our entire screenplay. So let us try to understand these story in our own language based on our own clinical experiences. So to add,
of course, in the clinical experiences, we do consider this, but how to analyze? I wanted to know that, sir. Okay, sir. Thank you.
I understand. I understand that question is valid, but unfortunately, I think we need not burn our energy at this point of time. What we need is to understand or get a better idea about this concept in our clinical scenario. Then only we can explain it in theoretical background. What I will try to put one extra
I
point.
do agree with that.
Yes. One point to what I explained earlier. See, two different clinical situations where Rasadushti is traveling to the upper side as well as the lower side. One is, see, an Amloshidam, a condition called Amloshidam, where Amla Rasa, Amla Dushtarasa or Pitta Dushtarasa is reaching the Netra Aveva, causing certain specific features of Pitta. Another situation is, see, Rasadushti going down to the maybe the Artavaha Srotas and causing features of maybe Pradaram, which is again a Pitta Rakta predominant condition. So in both ways, there is Vyapti or Prasarana of Pitta Dushta Rasadhadu. One is to the upper level and second is to the lower level. Both are Rasadushti, both are Pitta predominant. But how far is the difference in the selection of drugs for the Pajana? If that can be solved, then I think we can decide, or we can give more light to the question that whether we can presume that there is diffusely spreading Rasava Srodhas from the Amashaya as well as Pachimanashaya. Again, it is a clinical suggestion. I do not know whether the point is conveyed properly. Ashwin, did you get the idea?
I got the idea, sir. But it is now much difficult to find the drugs where they are acting in Amashaya itself.
Yes, yes. We will be discussing more about precision Ayurveda.
That will be very, very, very nice, and that will be very good because we will get the results very quick and more better answers. That makes a very big difference in Ashu Siddhaye. Everything will be
Yes.
depending on such factors, sir.
Yes, 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 yes.
It's very beautiful, and it makes us to think much every time, not every day. It's every hour, every minute. We will be thinking that much interesting things are evolving with the this type of explanations, sir.
Yes, similarly, the Rasadushti which is reaching the Hridaya and the Rasadushti reaching the Yagrut Pleha. So in the Yagrut Pleha Rasadushti, whether a management plane at the level of Pakvashaya is giving more benefit than focusing on the Amashaya alone is also another important clinical question. So that way also we can find better answers for these sort of Sharira based issues, which is again an important point of clinical understanding. Okay. Anyway, dear Nilesh, I think I took some extra time. Sorry for that. So I think we can conclude. It is 19 minutes past our scheduled time. Sorry for that.
No problem at all, sir. Actually, it was a very nice interactive session today.
Then give your input as well in 1 or 2 words, please.
Yes, sir. The things which we discussed today, those are really true. A few minutes earlier to this session, I came across with a patient, a female patient. She was having Lakshana like Amla Pitta, but I made my Nidan as Kapha Pitta because she was having all the Lakshanas related to Kapha predominantly, then to Pitta. So as we make Nidana, in the process of making Nidana, we what we can say, think of the Hetus more. And she was having Kapha Pradhan Hetus more as compared to Pitta Pradhan Hetus. So while thinking of what we can say, this Pachana process, the same thing is applicable. That if the Hetus are Kapha Pradhan, then we can make the diagnosis or Nidan as Kapha Pitta. And if the Hetus are Amla Pradhan, we can make the Nidana as Amla Pitta, like that. Yeah, and one more thing I wanted to add, sir, that what happens in Amashaya during Ajirna, or we can say it as Vidagdha Ajirna, and the next step of Vidagdha Ajirna is it's going towards Pittaj Grahani, that this Vidagdha Pitta, or the what we can say, the excessive pitta which has got vidagdha due to the hetus consumed by the patient, it bypasses the process of this Madhuravastha Pak. So pitta patient, they feel burning sensation or amlodgar immediately after consuming of food, any sort of food. So this Madhura Pak is surpassed, or it is totally overcome by this Vidagdha Pitta, and it goes into Amlavastha Pak. So
Very
in
fast.
this, in this Vidagdha Jirna, or in this what we can say Pittaj Grahani sort of things, we very frequently come across all these situations which we are discussing in these sessions. Yeah. So this point I wanted to add, sir, about this Vidagdha Jirna or Pittaj Grahani.
Yes. Very important. Very important.
All it is related to this Matrashiti.
Yeah. That is what I'm trying to say. Even though we are discussing a lot about Sharira, ultimately these points are going to help us in understanding Matrashiti better.
Matrashiti. Yes.
Okay, then we will conclude.
Yes. I think so. We will conclude today, sir. Thank you so much, sir, Prasad, sir, and thank you everyone. Yeah. Thank you, sir.
Okay. Shubharatri to one and all.
Thank you, sir.